So now I want to talk about the third stage of labour and go through the pros and cons for the different ways of managing this phase. So we've got two methods of delivering the placenta. So you can either have the active management or you can go for physiological or natural management. If you opt for the active management, then that is where we give you a small dose of oxytocin, via an injection into the top of your leg, into the muscle. The injection will then help your uterus clamp itself down and it will allow the placenta to come off the uterine wall, and as demonstrated in this picture here, your midwife or caregiver will pull gently on the cord, put some pressure at the bottom of your abdomen, and the placenta should be born within a couple of minutes. If you opted for the natural management of birthing the placenta, then this picture here demonstrates a typical physiological third stage. So the cord is not clamped and cut until the placenta has birthed itself. And you can see here the baby's still attached to the placenta. For the natural third stage, what you've got to remember is that you are still in labour and you still rely on all of those birthing hormones for this stage to work effectively. So you rely on lots of oxytocin to keep your uterus well contracted. Eventually what will happen is that the uterus will start contracting again, the placenta will shear itself off of the uterine wall, and you will have more pressure in your back passage, and then you will push and the placenta would be born. If you are opting for physiological management of the third stage, what you've got to be aware of is that it can take anywhere from 10 minutes up to 1 hour for the placenta to be born. And it can lead to some women having heavier blood loss at the time or shortly after the birth of the baby. What we are advised is in our guidelines to recommend that all women have active management of the third stage of labour, as this shortens the third stage of labour and also it reduces the amount of blood loss that you could have shortly after the baby is born. What I do need to make you aware of, though, is that if you do want to have a natural management of the third stage of labour, we will support you as midwives, and we are all trained to be able to manage this stage of labour quite effectively. And if you do opt for the active management of the third stage of labour, then there are some side effects that some women can experience with having the injection of oxytocin. These can be nausea and vomiting, a bad headache, your blood pressure can go up a little bit, and also for some women it can give them quite strong after pains. So that's the contractions that the uterus experiences after the birth of the placenta. What I would say, though, is that not all women will experience all of those symptoms if they have the injection. What the evidence does also tell us is, although it reduces the amount of blood loss that you would have initially by having the injection, that actually you might experience slightly heavier blood loss in the following few days following birth once the effects of the injection have wore off. However, when you have the natural third stage of labour, although you might have heavier blood loss initially, normally after a couple of days that blood loss starts to lighten off a little bit quicker. So the advice is to have the injection, but we would support you fully if you wanted to have physiological management. Again, what I would say is that if you are having a pregnancy that has added complexities to it, particularly if you are being advised that you are somebody who is at more risk of bleeding after the birth, that you would opt for the injection or the active management of the placenta. And if at any point during your labour you've had an intervention, such as hormone drips to speed things up, or you've had an instrumental birth or a caesarean section, or you've been induced, then it might be advisable again to have the injection for the third stage of labour. If you've had a very natural labour and birth without any interventions, particularly in a home or midwife-led birth setting, then physiological third stage could be an option for you. But if you do have any further questions on managing the third stage of labour, then please speak to your midwives individually.